Longer wait times and less attention could soon become a reality at local hospitals. That's a warning from state health experts who predict a nursing shortage. Eyewitness News reporter Erica Zucco found out why it's happening and what's being done to stop it.
Hundreds of students choose UT Health San Antonio's School of Nursing each year, often because they know firsthand the difference nurses can make.
They want to be able to give back, and they want to be able to do the same type of and perform the same kind of care and compassion that they received or that their family member received.
But statewide, there aren't enough new nurses to keep up with growing demand, according to the Department of Texas State Health Services. Texas's population is growing, more nurses are retiring or changing careers, and people living longer with medical conditions means more demand for health care.
We know that when there are shortages in nurses, that then there's a decrease in the health of the patients that are cared for.
To help ease the burden, UT Health has worked to get its students ready sooner and working longer. The school teamed up with more hospitals for internships so students are ready to work by graduation. They're also encouraging nursing students to get advanced degrees to qualify them for management and teaching opportunities.
Make sure that the students, when they graduate, are prepared to go into a variety of roles, whether that's the hospital setting or the community setting.
But experts say change is needed in healthcare overall to keep nurses happy and working. That includes easing heavy workloads and promoting work-life balance. Erica Zucco, KENS 5 Eyewitness News.